I'm Russell Bowles with KDADS. For the final rule, I am the Desk Review and Remediation Director. So let's get started with the training. So today we're going to talk about integration for HCBS participants. All right, so this is what CMS says. Home and community-based settings must have all of the following qualities and such other qualities as the Secretary determines to be appropriate based on the needs of the individual as indicated in their person-centered service plan. So specifically from the CFR, it talks about how settings are to be integrated in and support full access of individuals receiving Medicaid HCBS to the greater community, including opportunities to seek employment and work in a competitive integrated settings, engage in community life, control their personal resources, and receive services in the community at the same degree of access as individuals not receiving HCBS Medicaid. All right. So in a provider-owned or controlled residential setting, in addition to the qualities that are specified in the regulation, the following conditions must be met. Individuals have the freedom and support to control their own schedules and activities and have access to food at any time. Individuals are able to have visitors of their choosing at any time. This is all geared toward integration. And I also want to make clear when we talk about a provider-owned or controlled residential setting, in the IDD world, that specifically means if you are billing that taxonomy code of residential setting, that applies. In order to be compliant with the final rule, the agency needs to provide full community integrations to persons served within the bounds of their person-centered service plan. And any modifications or restrictions to the community integration must be addressed and documented in the individual's person-centered service plan and must not restrict other persons who do not have that restriction. All right, so let's talk a little about person-centered service plan and the relationship with final rule. The final rule is meant to describe how our provider manages a site. Compliance status indicates a site offers access to the community or any other pieces of the final rule to persons served at a comparable level to those not receiving services. Person-centered service plans are documents specific to each individual and reflect the needs of individuals. The PCSP may modify the individual's level of access to the community, but not invalidate agency policy, especially for others at the site. So in other words, the PCSP is directed specifically for the person that it applies to and should not restrict others from their rights and integration. All right, so if there are any restrictions due to a specific assessed need that would limit or invalidate final rule compliance, they should be reflected in the PCSP and not directly modify the overall policy of the site. All right, these are a few of the questions from the assessment that are related specifically to integration. So with that, addition to on-site activities, does this site provide opportunities for persons served to participate in community events, activities, and services? How would you address that through policies and procedures and other evidence? So these are things that need to occur and should be restricted only through the person-centered service plans. Okay, so providing access to community events. To ensure persons served are integrated into the broader community, providers must provide opportunities for persons served to participate in community events and activities and services. Share information with persons served about community events and activities, and allow persons served to attend community activities and services whenever they choose. Examples would be shopping, religious services, scheduled appointments, lunch with family and friends, any time with family and friends, and those things. So these could be addressed in policies. Procedures would be more specific as how these are accomplished. All right, so supporting access to the community. To help persons served access the broader community, you can do planned group outings, and keep in mind that no one should be forced to attend an activity. It should be their choice not to attend or to attend. Help individuals access events, activities, and services important to them. Could be but providing transportation or help them access community transportation when needed. And individuals have choice of when to be at the HCBS setting. If there are restrictions, persons served at the setting help develop those restrictions. So you need to include them. Continued for showing compliance is in policies, handbooks, and other documents, and pictures. So in policies, it should state clearly how the setting provides opportunities to the community, how information is shared with the person served, and that persons served have the ability to access the community individually. So those are policies and procedures. Handbooks should inform persons served, guardians, staff, and volunteers that persons served have opportunities to access the broader community when they receive services at a setting. Pictures can just, for the most part, support strong policies, handbooks, or other documents. So they work really well as supporting documents. So let's kind of put it together here. And so ensure community integration and compliance. Information is accessible to all via a policy, handbook, brochure, or other methods. And that policy should include a date, agency branding, a page number that lets us know how many pages are in this policy, and that those are minimum requirements to be viewed as a policy. And then when you turn in evidence, make sure to submit the entire policy covering a specific topic to answer the self-assessment questions.